If you haven't already, our next guests want you to get the party started, spreading the word that it's World Kidney Day. The CDC says chronic kidney disease affects almost 37 million U.S. adults. Treatment can require dialysis, even a kidney transplantation. Early intervention is key, and Dallas Renal Group says that their group of 40 nephrologists is dedicated to fighting CKD. And doctors Ratna Danda and Irfan Agha join me this morning along with patient Elizabeth Porter. They're here to share more. Good morning. Good morning. It's a day to celebrate for y'all. So Dr. Danda, I want to start with you. What's World Kidney Day and why is it so important?
Sure. So World Kidney Day is a global campaign to raise awareness about kidney disease. The theme of World Kidney Day this year is Kidney Health for All. Kidney disease is a silent epidemic. Approximately 37 million Americans have kidney disease, but the surprising fact is the majority of them, 9 out of 10, are not aware of having this. We now have a lot of treatment options available, either to reverse the disease in the early stages or prevent or delay late stages of kidney disease. And even in the late stages, we still have treatment options, including dialysis and kidney transplantation, to improve the quality and quantity of life of our patients. So there is always hope. Elizabeth here is a great example of this hope.
So Elizabeth, you know what it's like to live with kidney disease. Can you share a little bit about your journey?
Absolutely. So actually, I'm 30 now, and it started when I was 18, and I was about to go off to college, and randomly I'd gotten sick and my kidney had failed, and it was a complete shock to my family, and I was put on a ton of medication. So I went to college, a ton of medication, and I got my kidney back into remission because it was caught early. However, when I turned 25, unfortunately, I'd gotten the flu, and it flared up again. And at this point, my kidney was not going to recover. So those next couple years, this was about 2019, those next couple years were extremely tough for me and my family. I would say we spent the first year trying to save that kidney, and it became very apparent that wasn't going to happen. And that is when we had to go to the next option, which was donation. And that was something, I was terrified to ask anybody to do, and it was very scary. I was very fortunate because my cousin, Sarah, at 25 at the time, stepped up, and she was like wanting to do it, and she was so ready. She had been passionate about donating blood, and she's like, I want to do this. And I was so blessed because we found out we were a match about 2 months before the surgery. And when I went into the surgery, in my mind, I had just had such a tough 10 years on and off with kidney disease. I thought there's no way this is going to work. I was like, I'm just going to, get this kidney. It's going to be hard for Sarah, all these things. And I woke up the next day and I felt incredible. I mean, even the day after the transplant, obviously I was sore, but watching my labs, it became incredible to see. And Sarah herself, she's doing amazing. She's actually coming into town today. So I get to see my donor, and I get married on Saturday, so she's going to be my bridesmaid, and she is doing amazing. She's doing incredible. Yay. She said if she could do it again, she would.
So a happy ending to this story,
yes.
All because of what y'all do. Okay,
Absolutely.
So Dr. Agha, how do we combat the epidemic of chronic kidney disease?
That's a very important question, Jane. So I will answer your question with 3 words: awareness, access, and action. As Dr. Danda said, the theme of this year's World Kidney Day is Kidney Health for All. So this is the creed with which we live by at Dallas Renal Group every day: provide awareness about kidney disease, access to world-class, competent, and cost-efficient kidney care, and then developing a plan, an action plan. That's the most important part. We need to take action to avoid bad outcomes. So if you've got diabetes or hypertension or other risk factors for kidney disease, check your GFR number, check for albumin in the urine, simple blood test, simple urine test, and if there's any cause for concern, take action. We at Dallas Renal Group would be honored to take care of these patients, but the message of the day today is do something, see someone, take action.
And Elizabeth is an example of the success that y'all can have. Thank you so much for joining us. Thank you so much for joining us. We really appreciate it. Dallas Renal Group has several locations throughout Texas. Go to dallasrenalgroup.com to find a location near you and for all your information.